So I'm gonna start off with the medial hip and thigh stretch. According to the video we have on Blackboard, the medial hip and thigh stretch is normally done or best done with a caregiver. So, the caregiver, so I'm the patient and the caregiver is helping me out. The patient would want to do like make a figure four with their legs. Ideally, their ankle is above their kneecap. If they are able to go this far, then the clinician or the caregiver would have one hand pushing down on the knee, ideally holding on to the inner thigh above the knee, and the other hand supporting the opposing hip. And the caregiver would just push down, and you should feel the stretch on the inside of your thigh. But in really good at-home variation, you could do by yourself, and the patient and clients can do by themselves is just the simple like butterfly stretch. So if you just push all the way down, 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 push on the sides of your knees while doing the butterfly stretch, you really feel it on the inside of your thighs. And if you want any more like active stretching, just push down even harder and you'll get the results you want. So the next exercise that I'm gonna do is the bent knee trunk flexion stretch. So ideally how this is done is you want the patients to have their feet flat on whatever surface they're on, their hands in between or their arms in between their legs, and you want them to reach forward as far as they can. A good variation that I like to do that involves a little bit more active stretching is just using a towel and a desk. So I wrap the towel around the leg of the desk, and I'm the patient. As I have my hands or my feet flat on the ground, my hands in between my knees, I pull forward to get that additional like extension and additional range of motion. I like to hold this for 4 to 5 seconds, and then I let go. All right. And the last one that I'm doing is the thoracic lumbar rotation. A really good at-home variation for this stretch is to use a chair. Preferably, you want to be using a stationary chair, like one that doesn't like rock around or move. But just for demonstration sake, I'm going to use this. So you want the patient to be sitting kind of near the edge, not near the edge of the chair, but just forward a little bit. And you want the patient to look across their shoulder and grab onto their chair and kind of just twist their chair or twist their body in the opposite way and hold this position for about 2 to 3 seconds and then switch it. So 2 to 3 seconds the other way, and then you should be good.